Looking at the orbit from the superior approach, to the right is our midline, lateral over here, anterior to the top of our view. The periorbita has been removed. The first thing we should see is a frontal nerve. As the frontal nerve comes forward, we can see a small branch coming off called the supratrochlear. It's going to be the most medial. And then the more lateral is supraorbital. Now the supraorbital we might see splitting into multiple branches. But as long as we have the medialmost and the lateralmost to differentiate those two supra branches. If we look laterally, we can find a significant nerve running the length of the lateral rectus muscle. This is the lacrimal nerve. Okay? If we look deep to the lacrimal nerve, we do find the lateral rectus muscle seen inside here, and any nerve going to the lateral rectus will be the abducent nerve. So the differentiation between a lateral or a lacrimal nerve and an abducent nerve would be which one is embedding into the muscle. It would be abducent. Coming more midline, deep to the frontal nerve, we can first find the levator palpebrae superioris, and deep to that, the superior rectus. Both have been cut here. If we look to the deep surface of, say, the superior rectus, we will find sometimes small nerves entering the surface called the superior division of ocular motor. Looking more medially, we can find the superior oblique muscle. Any nerve entering it from the posterior would be the trochlear nerve. If we follow the superior oblique muscle anteriorly, we would see that it's going through a trochlea. This is a connective tissue loop that the tendon will pass through. We don't see it here, but it would be anteromedial in this area. Coming back towards the midline, deep to the superior rectus, we should find a large optic nerve. The optic nerve going into the posterior of the eyeball. If we see a significant nerve crossing from lateral to medial over the optic nerve, that is the nasociliary. Now here we don't see all the pieces of this, but I'm going to talk you through it. If we find this nasociliary and we can find long, skinny, fibrous, hair-like nerves coming off of it going to the eyeball, then that would be long ciliary. If more in the lateral position, if we could find a small bump, that would be the ciliary ganglion. And if we see little hair-like projections from that to the eyeball, that would be short ciliary. We do not see that here. If I can find one, I will re-record this to show you those. Any other thing that we can find in here would be the ophthalmic artery. Really, usually if we're in the orbit from the superior, we're just seeing a branch of. It's starting more lateral, crossing over more medial, but the ophthalmic artery is the only artery we look for within this system.